My name is Alyce Adams. I am the Stanford Medicine Innovation Professor and pleased to co-lead the pilot application core for the Upstream Research Center. Upstream is dedicated to eliminating cancer inequalities in persistent poverty areas in Northern California, uniting diverse communities of partners and patients and scientists from Stanford University, the University of California at Davis, and the University of California, San Francisco. The center is evaluating and scaling innovative income supplementation programs and policies that can address fundamental causes of cancer inequalities in these areas. Today, I'm excited to talk with Tracy Lam-Hine, one of our awardees for the Upstream Pilot Program. Hi, Tracy. How are you today?
Hi, good morning, Lise. I'm good. How are you?
Wonderful. Thank you so much. I'm wondering if you would do us a favor and tell us a little bit more about your exciting project.
Sure, yes. Well, maybe first I'll just say a little bit about who I am. I'm a postdoctoral scholar in epidemiology at Stanford. I'm a social epidemiologist, so I focus on sort of the social and structural factors that are linked to, and we hypothesize to create inequities in health outcomes. And so that includes cancer. And historically, I would say I've actually not really been a cancer researcher. I think of myself as a chronic disease researcher. But this has been a really exciting opportunity for me to learn more about cancer disparities, and sort of the etiology of those disparities itself. And so my project, I'm actually looking at local level policies that we hypothesize to influence structural racism, which then, of course, we know influences inequities in social determinants of health like income and wealth, which is what the Persistent Poverty Grant and Upstream is focused on, and how that is then translated into cancer disparities by race and ethnicity. And so I'm really looking at sort of those policies that you see on the ballot every year, including this upcoming year at the local level, and sort of things like rent control, things that we know are hypothesized to link to racial inequities and social determinants of health.
Wonderful. Thank you so much for that description. And we were so excited to see your project at Upstream. Can you tell me a little bit more about what motivated you to apply to the Upstream Pilot Program?
Yeah, well, as I mentioned, I have never really worked with cancer data, honestly. I'm a postdoc, so most of my dissertation research was not focused on cancer as an outcome, but obviously cancer is a huge problem in the United States and globally. And so I was really excited about the opportunity to learn a little bit more and explore cancer as an outcome. And my PI, who's involved with the project, encouraged me to apply. And I think it was a really nice kind of push in the right direction for me to understand more about this disease that historically I think had a fairly biomedical focus, but increasingly we're starting to really look at social determinants of health in sort of the incidence of cancer as well. And so I think it was a great sort of opportunity to learn more about an outcome that I had not previously worked with.
Wonderful. Thank you so much. And I wonder if you could tell us a little bit more about what's most exciting to you about the project so far. Any surprises, anything that you weren't expecting that you found in your research?
Oh, surprises. Well, I guess I'll start with what's been good. I have had the opportunity to work with a mentor for this project at UCSF, Salma Sharif Marco, who's in the Cancer Control Center at UCSF in epidemiology and biostatistics, and is also involved with the California Cancer Registry. And it's been such a nice introduction to a whole group of people that I had never met before and are really doing incredible work around social and structural determinants of cancer disparities. And so I think my work was a nice sort of complement to the sort of more, I think, meta level ways that we think about structural racism. And sort of my focus is a little bit more on the actual policies that we see, literally, like I said, on the ballot, and how we can study those as determinants of health, rather than maybe just something like segregation, just broadly. And some surprises. Well, I would say, I think one surprise, we started, and maybe we can talk about more of this a little bit later, but this project started out actually as a partnership with a health department in a local Bay Area county here, Solano County, which actually is where I'm from originally, just a coincidence. And so we were working with the health officer there to start surveilling local, like city level ordinances and things like that, that we hypothesized to influence structural racism, and then eventually health outcomes like cancer. And I was really surprised because I'm from that county, and I think actually just digging into the policies and looking at what is in the municipal codes, what policies are in effect, kind of surprised me and maybe changed some of my assumptions about sort of the political stances of different areas in those in that county where I'm from. And so I think that was like actually quite surprising. And when I talk about the results from that initial phase, I'm always kind of laughing to myself because I'm always learning about the place where I'm from.
That's fantastic. And I love that you mentioned the importance of the cross-institutional collaboration. That's something we certainly hope that these pilot projects will be fostered by these pilot projects throughout Upstream. So thanks for saying that. And I'm glad it's working out. Can you tell me a little bit more about your experience working with the community? As you know, with Upstream, engaging community partners is critical to our success and what we're trying to do. So I'm curious about your own interactions with the community, how that's going.
Yeah, so I think overall it's been a surprisingly like strong reception for this work. I will say I think that in the last 5 years or so, there's been this very strong, I think, people call it an awakening or sort of this new realization about how sort of what we think about as day-to-day policy maybe is just kind of like just not very exciting stuff about how a city may operate actually really is important to shaping the way that people live and how racial inequities sort of show up in our society. And so I will first say that I think working with our health department partners, who I'm going to include in that community bucket, since they're not in academia, right? And they've kind of been the ones that have been pushing us to think more, think out of the box, I guess, conceptually about what we mean when we say structural racism. They've been so good about not letting us fall into these sort of what we could sometimes describe as heady descriptions of what structural racism is. And they're like, no, no, we're really interested in actually changing something. So don't talk to us about, some sort of like latent construct that we can't actually really do anything about. We want to look at actual policies on the books because we want to make a difference. And so that has been really, really exciting and interesting to be pushed by our community partners, health department partners, to get away from sort of these jargony or potentially non-modifiable ways we think about structural racism and think about what can we actually do to fix it, which is great. And I'll also say then I think that in presenting our results to sort of the community partners at the Upstream retreats, the community coalitions that we've been sharing this information with, I think has been really, really powerful for me because again, I have some connection to this, but I think a lot of the folks who are, working with people with lived experience and sort of cancer disparities and sort of see these the effects of these policies day in and day out are really, they're seeing when I present, when I talk about, it really resonates with them and they really understand sort of the mechanisms that are linking what's going on at the policy level into people's everyday lives. And so I think that's been really encouraging to see sort of just even coming up to me after presentations and being like, thank you for doing this because this is like what we're trying to work on every single day.
That's fantastic. Thanks so much for sharing that. And yeah, I always think about our community partners as forcing us to keep it real, right?
Yeah, absolutely.
So that's fantastic. And I'm
Yeah.
curious, do you have any results that you can share with us at this time about your project?
Well, so I will say that because I'm working at the city level, it's been really, really, really tricky to get cancer data that is anonymized at the level that we need and sort of de-identified to the kind of ways that I can actually use it in my analysis. So the cancer data has taken quite a bit of time, but it's here. And so I'm now getting familiarized with the data set, kind of working on that stuff. So I don't have any results for cancer yet, but in terms of the policy surveillance work that I've been doing, we've used policy surveillance methods, legal epidemiologic methods to essentially identify these policies that we hypothesize to link to structural racism. And that's been this whole sort of almost like a qualitative research project with experts in structural racism. And so in that initial phase, right, where we're working with the health department in Solano County, we're still working with them. We identified like 11 or 12 policies that we sort of thought might be related to structural racism. And in the second phase of this project, we really expanded this to formalize and get a lot more data on sort of exactly how those policies are implemented. And we've expanded to 24 policies now at the local level. And that may not sound like a lot, but there's a lot of very detailed information about specifically, for example, if we're talking about limiting police pretextual stops, like what are police now barred from stopping people for? Is it specifically like having only one license plate or not having a turn signal on? And so like to that level of detail, we can actually surveil these policies and understand what aspects of those policies we hypothesize are driving changes in health outcomes.
Well, that's fantastic. As a health policy researcher, I appreciate just how difficult that is. So
Yeah.
congratulations. And thanks so much for talking with us today about your project, and congratulations.
Thank you so much, and I appreciate the support. Thank you. It's been a great experience so far.
Wonderful. And to any of you listening or watching today, we have an open pilot application call open right now at the Upstream Research website. You can go to upstreamresearchcenter.org to find out more information. Thanks so much.